Every vascular presentation is different. Some clients come in just with one or two little spider nevi on their faces, just little thready vessels. Some clients come in with really extensive broken capillaries often across their cheeks, but sometimes chin, nose, sides of nose, lots of different places. Some clients have a mixture of capillaries, distinct capillaries, where you can trace along that vessel clearly with your naked eye, and an underlying background of diffuse redness, so just generally red all over with capillaries through it. Some clients don't have any distinct capillaries, they just have that diffuse redness. So how we go about treating these various presentations, I'll run through with you now. So if a client comes in with quite distinct visible capillaries, often that's just genetic. It can be, those vessels can be there in relation to food and diet over the years, alcohol intake, medications, and sun exposure. They often there's a lot of capillaries brought up to the skin surface just through years of accumulated sun exposure, where our body, it doesn't have many tools in its toolkit to heal itself from sun exposure. So what it can do is bring extra blood supply to the area and hope that can heal it a little bit. So sometimes when you see quite a sun-damaged client, there'll be capillaries there as well, and that's why. So if a client comes in with quite distinct capillaries, they do respond really, really well to treatment. So just clarify that the client's not on any blood thinning medications. If they are, it can compromise the results of the treatment. So if possible, we ask them to stop those medications for about a week prior to treatment, and for at least a couple of days afterwards. And just check they're not on any photosensitizing medications, which is a risk factor with any laser treatment. And check that they've been sun protective in that area. We can't treat over really sun exposed skin with the vascular treatment as with any laser treatment we do, because it increases the risks of pigmentation changes or a laser burn. Once you've ascertained that the client's suitable for laser treatment, you can run through the consultation. And describing the way the laser works, we select for capillaries treatments, we select the 1064 nanometer wavelength in our GentleMax Pro laser, and that's because that wavelength is really strongly attracted to and absorbed by hemoglobin. So what happens is that the blood in that little vessel in the client's skin really strongly absorbs the laser energy, instantly converts to heat, and we thermally coagulate that blood inside that little vessel. So we stick that vessel down to itself, and the body no longer realises it as a feasible vessel because it can't get blood through it anymore, so it bypasses. So we can shut down all these superficial little vessels in the surface layers of the skin, and the body will bypass them, and the blood vessels will be deeper within the skin, and there's less presentation of redness on the surface. The clinical endpoint during a vascular treatment, when we've treated those little capillaries with the laser, often they'll disappear on impact. Like it's quite a fun treatment to do. You'll see the vessel just blanch and just disappear as treated. Often in the slightly larger vessels, often they'll go a very dark purple and still be visible, and that's because of that coagulated blood inside the tissue. So we need to allow about 4 weeks after the treatment for the macrophages in our bloodstream. They're like little Pac-Men that tidy up around the body. We need to allow those macrophages time to break down and remove that vessel that's no longer viable and no longer in use. So the darkened little vessels that may appear, they can take a few weeks to completely clear. The client can get bruising, but it's rare in facial vessels. The risks are overheating the surrounding skin when we're treating the vessels. So if there's really extensive vessels in the area, we would treat it over staggered sessions. We wouldn't treat it all at once because it would be too much thermal accumulation in their tissue. So every presentation is different. Just see what you're dealing with and work out a plan then. So assess the client without any makeup on and work out your plan. The risks are, through that overheating, it would be blistering, or the obvious risks of pigmentation changes or scar formation. So always just run through those risks, of course, but we treat a few shots, obviously in direction of fill. So you start at point of fill and work your way down the vessel. Assess every shot as you're going, because every vessel is different, as well as every client is different. Every vessel is different. So make sure as you go that you're happy with the settings, and you can tweak them as needed throughout the treatment. The expectations for the client are ask them to allow those weeks for the macrophages in their body to finish off the work that we've triggered, and make a plan with them that it won't be a quick fix. They may well need more treatments after this first one. They may need a follow-up treatment 4 to 6 weeks after the first one, a full treatment, or they might need just little touch-up treatments now and then because they've obviously got a vascular skin type to start with. It's just a hereditary condition in lots of cases. So they'll probably find their body does bring up new little vessels to the surface of the skin, and they can just call and come in maybe once a year or something for a little tidy up of new vessels. And the aftercare with the vascular treatments of capillaries with the Gentle Max Pro, the aftercare is just a little bit of aloe vera gel, very gently dabbed on the area. I don't tend to put a cold pack on unless they really need it, because I don't want to bring any blood flow to the area with sort of excess cold or anything. If they can, once you remove it, they can get a bit of a flush of blood to the face. So really just a little bit of aloe vera gel, and if they need it, they can have just damp face cloths and things at home. Some clients, if they've had a fairly extensive treatment, put wet face washes on plates in the fridge and then just rotate them out of the fridge just to take that initial warmth out. And they might be very slightly puffy the next day under the eyes, depending on how much work they've had done.